Good morning, everyone. Just wanted to say thank you for attending the Elderwerks Virtual Senior Fair. My name is Abby Marsegan. I'm the Director of Admissions of Lexington and Lake Zurich. Lexington Health Network offers healthcare and living options to seniors. Lexington has 8 skilled nursing facilities in Illinois, such as Chicago Ridge, Bloomingdale, Elmhurst, Orland Park, Lombard, LaGrange, Schaumburg, and also Lake Zurich. That provides post-acute rehabilitation needs. We also offer independent, assisted living, and supported living options for seniors. And our diverse network also offers home health, hospice, and private care services. So if you have any questions about Lexington, I can put my information in the chat box. This next class is about the introduction of LSVT BIG therapy for people with Parkinson's disease, presented by Bruce McElroy. Bruce is currently supervising an outpatient physical therapist at the Northwestern Medicine in Northwest Region Rehabilitation Services in Crystal Lake. Bruce has been a physical therapist for over 25 years and has specialized in McKenzie-based evaluation and treatment of spinal extremity conditions, vestibular and balance programs to prevent falls, and more recently has started an LSVT BIG physical therapy program to treat people with Parkinson's disease. With no further ado, here is Bruce.
I would like to thank Elderwerks for this opportunity for myself and Northwestern Medicine to be able to present on a wonderful outpatient rehabilitation program designed specifically for people living with Parkinson's disease. It is called LSVT BIG for physical and occupational therapy and LSVT Loud for speech therapy. LSVT stands for Lee Silverman Voice Treatment. It is named after a patient. Her name is Lee Silverman, who was going through voice impairments related to Parkinson's disease. She was being treated by a speech language pathologist who was one of the co-founders of the program back in the latter half of the 1980s. The program was developed and became the LSVT Loud program, designed to teach impairments in the speech motor system. The patients were getting such significant beneficial changes in their voice quality that the principles for these changes were adopted to the motor limb system to become LSVT BIG. Today, there are over 26,000 physical therapists, occupational therapists, and speech language pathologist practitioners worldwide who treat in the LSVT Loud and BIG method. LSVT Global is the organization that certifies clinicians with the vision to empower people with Parkinson's to live bigger and better lives. And what I like to think about is bringing out your hidden potential. Again, as the introduction stated, my name is Bruce McElroy. I am a physical therapist for 25 years. I supervise at the Northwestern Medicine Outpatient Clinic in Crystal Lake. I specialize in the McKenzie method for people with neck, low back, arm and leg conditions. I specialize in vestibular and in balance conditions to overcome dizziness and fall risks. And I've recently been certified in LSVT BIG, along with a physical therapy assistant that I work with, Joe Budrick. And we are excited to offer this program at our clinic and to our community to improve the lives of people living with Parkinson's disease. I just wanted to give a quick disclosure that I do not have any financial relationship with LSVT Global, nor am I a representative. LSVT Global provides the LSVT certified clinicians with this presentation in order to inform the public about LSVT BIG. So this is what I'm going to cover in today's presentation. It's more informational. I'm going to talk about the key features of LSVT Loud and LSVT BIG therapy, how these programs address motor and non-motor symptoms of Parkinson's disease. I'm going to go through an overview of what an LSVT BIG session looks like, research some highlight topics, talk about how exercise and therapy can both help you, and how to get started with LSVT BIG. Neurological disorders are now the #1 cause of disability, and Parkinson's disease is one of those disorders, which just happens to be the fastest growing neurological disorder. It's increasing at a faster rate than even dementia. In the US, there are estimated to be about 1 million people living with Parkinson's disease. And the disease is prevalent in Illinois in particular. Illinois, we are the 3rd leading state in prevalence behind the District of Columbia and New York State. By 2040, it is anticipated that Parkinson's disease diagnoses will double from present levels. So this is quite a significant problem with people, or a significant diagnosis that people are going to encounter. When we ask patients newly diagnosed with Parkinson's disease about their goals of therapy, one of the most common things we hear is, I don't want to lose anything. And for people who have had Parkinson's for some time, we find they simply want to do everything as they did it before having Parkinson's disease. This could be improved movement, energy, balance, communication, and more. Parkinson's impacts function in everything a person does at home, at work, and in their recreational pursuits. The LSVT programs help you to restore and maintain your movement and voice, which you need for normal function in everyday life beyond medication. So LSVT Loud is the program conducted by certified speech-language pathologists, and LSVT BIG is the program conducted by certified physical and occupational therapists. LSVT has been studied and used in the clinic for over 25 years. So this is something that's not new. In a moment, I'm going to show a video. Her name is Shirley, and this is a patient who's a 59-year-old female. She's been diagnosed with Parkinson's for 2.5 years since her diagnosis. She had noted changes in her voice and speech. She is on medications both in the before and after videos, and there's been no change in her medication throughout the course. She had a 1 month of intensive speech therapy program, and I'd like to show you what her results were after that.
Changes in your speech or your voice that you would associate with Parkinson's.
Is that coming through?
Yes, it is.
Loud enough a lot of times.
I'm sorry for my
Anything
remedialness.
else?
Hoarse.
Anything else?
I stutter, which I never did before.
Do this for me if you would. Take a deep breath and say ah for as long as you can. Good for you. Okay. Would you say Parkinson's disease has caused you to talk less?
Yes,
Because?
because I stutter and then I can't be heard. If there's noise in the house, like when the kids come over, nobody pays attention to it because they can't hear me. Till I get mad and then yell.
Take a deep breath and say ah for as long as you can. Have you noticed changes in your speech or your voice as a result of the speech therapy?
Oh, yes.
What have you noticed?
I talk louder. I think louder. I'm going to sing with the Sons of the Pioneers one of these days with my voice.
Good for you. That's excellent. What practicing do you do at home?
My ahs, my highs, and my lows. And I read out the mail out loud.
Excellent. Do you feel like practicing helps?
Oh, yes.
Okay. Do you feel as though people can understand you all of the time now?
Majority of the time, unless it's my husband, and he'll say, "What? I can't hear you."
Good for you.
But I think he does that just to be cute.
I think he does too. Has anyone commented that it's easier to understand you now?
Oh, yes, I set some of our friends back when we went to their house and I talked loud. Lou says, "What the hell happened to you?" My daughter said, "Oh, Ma, that's you?"
Isn't that good? Don't you feel wonderful?
Oh, yeah, because now she can't say, "I didn't understand what you said."
Right? No excuses, right?
Yeah,
That's
no
right.
excuses.
All right. So what do you do when you want to be as easy to understand as possible?
Think loud.
See, obviously results will vary, but this is a dramatic change in 1 month. So this is a video of Bernie showing his walking ability side by side before and after a 1 month intensive LSVT BIG program. Bernie is 71 years old at the time, 14 years since diagnosis, referred to physical therapy for slowness, difficulty walking, falls, and freezing. Again, his Parkinson's medications were optimized before starting LSVT BIG. There's been no medication change. So here's Here's how Bernie looks after 1 month of LSVT BIG therapy. Again, on the left is Bernie prior to starting the program, and there he is after. Again, now you can see Bernie walks without a cane and with a much larger step length. Walking speed is dramatically increased. Arm swing is improved. More erect posture than before. This is quite a change. If I didn't know it was the same person, I would say it's not the same person. So this is the concept I think about as far as bringing out the hidden potential in people. And so again, I'm going to stop it short there. It just shows them eventually walking to their car and just more of that style of walking. But this is a dramatic change for Bernie.
Those are amazing, Bruce. Real quick, there's a question.
Yes, okay.
Is LSVT covered by insurance?
Yes, it is. And we'll get into that later. It requires a doctor's script. If it's LSVT loud, it's for a speech language pathologist. If it's for LSVT big, it can be for physical therapy or occupational therapy. The difference though is that people conducting the program need to be certified in LSVT big or LSVT loud, and there's some information on that as well and a website to go to. So with Bernie's results, as you can see, before he was falling once or twice a month. Afterward, no falls. He went from using a cane to not using a cane. Balance was improved. Walking speed was much improved. He's now walking at 100% of normal and able to walk much further. His goals were accomplished. So there are 3 key features of LSVT loud and big. The first is the target. This is what we focus on. We focus on one main thing, and that's the amplitude of how you move or talk. So often in therapy, there is cueing for stand tall, head up, step with heel first, swing arms. The list could go on and on. Instead, we focus on moving and thinking big or talking and thinking loud. This simplifies things a lot and is much more effective. The second, and we'll get into this, is the mode or how we have patients train. We train with high intensity and high effort while we focus on this increasing amplitude. And the third concept is called calibration. This is the concept of providing a resetting of how the body, mind moves and speaks. It's like creating a new normal or new baseline of moving. We want to focus on lasting improvements. Again, this is bringing out the hidden potential like we saw with Shirley and Bernie. Mode. So the main focus is on amplitude, this loudness. We're progressing from talking softly to a healthy vocal loudness, and from small movements to healthy, normal looking movements. Again, we use a single cueing method, and that's key. So we want people to speak and think loud and move and think big. In Parkinson's disease, small fine motor movements can become too small. This video demonstrates this with buttoning. LSVT big provides strategies to overcome the tendency to move smaller than even what you need to move.
Good, and I want you to just kind of notice as you're watching Bob do his buttons, it's a very slow, small kind of movement that he's using to try and get those buttons through the buttonhole.
Yes, we do struggle.
And this can be a very frustrating thing for a lot of people, Bob. You're not alone in that. Does the top button tend to be one of the hardest ones for you?
Yes.
Okay. Good, you got it though. All right.
So this is one strategy.
Well,
Let's do it. Ready? 1, 2, 3. Go again.
So imagine you have water on your hands, you're flicking it off to improve the dexterity and ability to do flexible movements.
Really push it in hard. Nice.
About a third of the time.
You're right. Good job. Now go back in and close it like you're angry with it. Really push it in strong. Nice. How fast is that?
Even quicker.
Even quicker. You're right.
I haven't done a button that quick and I don't know how long. Good.
Again, LSVT big provides strategies to overcome the tendency to move smaller. So the mode means how we train. We train with high intensity and high effort. So what this means is LSVT sessions are 4 consecutive days a week for 4 weeks in a row, 16 sessions. Each session is 60 minutes, individualized care, no groups. There is expectations for daily homework and carryover assignments for all 30 days, and expectation of lifelong exercises thereafter. In order to learn how to do a new task or to improve on a current task or skill, there are 5 key components that allow the brain to best make these changes. Effective brain change and learning, which is also called neuroplasticity, is achieved through these 5 concepts. The first is intensity. So intensive practice is needed for brain change. In LSVT BIG and loud, we focus on increased amplitude of movement. Then we add repetitions, resistance, and balance challenges to reinforce those larger movements to make them feel more normal. The second is complexity. It's important that we start with easier movements, but then we soon progress to more substantial environmental challenges, moving to harder, more complex movements, and again, more complex environmental challenges. Thirdly is repetition. Brain change requires a lot of practice, a lot of repetitions. In LSVT, we go well beyond that thought, practice until you get it right. We go to practice until you can't get it wrong. The fourth is salience, and this means practicing something that is emotionally rewarding for you, or practicing something that is very important to you. Again, this helps with increasing your motivation and desire to improve and makes changes for the better happen. And then lastly is this concept of specificity, the concept of training the specific deficits you have. So that means we train to work on larger amplitude movements, and we practice the actual functional tasks that you want to succeed at. LSVT therapies incorporate all 5 of these neuroplasticity components. So this idea of calibration is our ultimate goal. It's this concept of how to make more lasting and permanent changes in the skills we are working at, creating a new normal or new baseline for how you move and speak. In Parkinson's disease, there are many other symptoms going on in addition to moving slower and smaller. There's tremors, rigidity, postural impairments. But in particular, I want to highlight there's a worsening of the kinesthetic awareness of how you move or speak. So there's this mismatch in how you think you are moving and talking from how you are actually moving and talking. This is a very important concept. People with Parkinson's disease often feel they are moving and speaking normally when they are not. On the flip side, when they move with bigger movements, this often feels too big to them, when in fact it is closer to normal. So having an awareness and feedback is critical to overcome this mismatch. Other non-motor symptoms may include the lengthy list on this slide. So there's changes in your cognitive functioning, your slower thinking, your ability to do sustained attention, divided attention tasks, your self-cueing tasks, your retrieval information is affected, emotional changes of anxiety, apathy, the sensory changes that I talked about, but this could also be having pain, tingling, burning. There are changes in blood pressure, bowel bladder, blurred vision, shortness of breath, sleep disorders, depression, and dementia. So the key part here is that all these non-motor symptoms affect your ability to move and learn. Parkinson's disease is complicated. So in order to make more permanent and lasting improvement in your moving and talking skills, specific, personalized, and meaningful feedback and practice is needed in order to achieve this calibration, this lasting change. Again, it's this awareness and recognition that in order to move more normally requires you to move bigger than you think you should and with more effort. And this is one of the main challenges to overcome. LSVT certified clinicians provide this necessary feedback and overall system of practice to help patients recognize and apply the amount of effort that is needed to move normally. Again, bringing out your hidden potential. In a typical LSVT BIG session, it is divided into 2 segments. The first part is practicing what are called maximal daily exercises. And these are core large amplitude movements done every day in the clinic and at home. The second part involves practicing these large amplitude movements in specific functional tasks that are important and meaningful to you. So these are the examples. There are 7 core maximal daily exercises that they're called that focus on large amplitude movements, and they involve dynamic stretching, strengthening endurance, stability, and balance exercises. I'm going to highlight a couple. This is an example of this. This is an example of the step backward and reach.
Our next exercise is the step backwards and reach. You want to be sure to start with your big posture, and you're going to have big hands. And then we're going to do a nice big step back, big arm movements, and then come back and finish big.
Okay. Here is an example of the rock and reach forward and backward exercise.
You want to start with your feet in a big posture. Big step forward and nice and big and wide. Now you're going to begin to rock forward and backwards with a big rocking motion as you go. Now let's begin to add your arms. So big reach, big rock, big reach, big rock. Now we're going to switch your feet and we'll do the exercise again. So put your other foot forward, big step, nice and wide. And we're going to begin to rock back and forth big. Add your arms, get your movement going, and we'll start the count now.
Okay, and again, I'm just going back to this slide. So there ends up being, there's 2 sitting exercises. There are 5 standing exercises. These can be adapted if someone has a balance challenge. They may need to stand with a chair that they can hold on to. If their disease severity is more restricted, we can adapt these all to sitting, and we can adapt these to a lying down position as well if needed. So the core LSVT BIG exercises help with starting and stopping movement when you want, making turns and direction changes more smoothly. It works on endurance, balance, strength, range of motion, and posture. Again, the goal is to learn the larger amplitude movements in order to apply them into your everyday activities. This slide is a good example of incorporating weight shifting and arm swing into the goal of better arm swing and stability when walking your dog. LSVT BIG is used to improve function related to mobility. So walking, transfers, bed mobility. Also, it's used to improve activities of daily living, such as dressing, bathing, feeding, toileting, recreational activities, work-related activities, and many other activities or tasks which are part of everyday life. The approach is personalized to your specific needs and goals. One of the functional skills that is worked on daily is sit to stand. The video shows how this important—
Reach big, up big, reach back big, and down.
So this video shows how this important functional task is taught and performed. So this slide reiterates the concept, which is not new at all, that exercise is medicine. This is being preached more and more. The human body is designed to move. In Parkinson's disease, as in a lot of other conditions, there is a tendency to move less and sit more. This can make stiffness and movement quality worsen, in addition to worsening stamina, balance, mobility, strength, etc. So on off days of therapy during the program, as well as during the maintenance phase when therapy is ended, the daily exercises are recommended to be done. It's just like taking your daily dose of medication. After LSVT therapy is completed, there is lifelong support through the following means. This could be continuing the daily exercises. There's an option of homework helper videos that can be purchased or downloaded. Getting involved in a community-based program for Parkinson's disease. The Huntley Health and Fitness Center has a program called Rock Steady Boxing. I believe in the current situation with the coronavirus pandemic, it's not going on now, but it will be. Joining a health club to continue workouts or exercise classes is an option. Again, we encourage people to participate in the Parkinson's disease support groups in the area. And for some, I would say often many clients, coming back for an LSVT tune-up is often needed, especially if there has been a change or worsening in your function, which can be caused by a number of factors, which we covered earlier. So when looking at your options for therapy, it is important to know if it is evidence-based practice or not. So a program that is evidence-based answers the following questions. Has there been research? How do you know it works? And are the results lasting? Again, the aim of something evidence-based is to establish the most effective care with the best outcomes. LSVT Loud and LSVT BIG is evidence-based with over 20 years of NIH-funded research, giving you confidence that the treatments work. So I want to highlight the research on LSVT BIG, or at least one main study. One physical therapist conducted a comparison study on 3 treatment interventions for Parkinson's disease back in 2010. 60 participants were randomly selected into 3 groups. The groups were LSVT BIG versus Nordic walking versus an extensive home exercise program group. The walk group is a Nordic walking group, which is a standard treatment approach for Parkinson's disease in Germany. It is traditionally delivered twice a week for 8 weeks. The home group was instructed in a multifaceted home exercise program, much like what you would have from a physical or occupational therapist, working on balance, strengthening, mobility. Each group got the same total number of hours of exercise. So on the slide, the big group, the line that is dashed, that is dipping down, so that's the big group on the graph above. And the LSVT BIG group was the only one to improve on the Unified Parkinson's Disease Rating Scale. This scale has it so that's the lower the overall score means a lower in the overall disability of Parkinson's disease. So essentially a lower number shows improvement. LSVT BIG showed improvement at 4 weeks. The home program and the walking group did not. What is also important to point out was that when they studied people at the 16-week mark from baseline, they found out that the LSVT BIG group had maintained those improvements. Again, the walking and home group did not have improvements. So this is this concept of calibration, bringing out that hidden potential. The research on LSVT BIG has also shown what we call cross-system effects. So when we train high effort and intense big amplitude movements, we get improvements in other areas. Improvements in trunk rotation, stride length, walking speed, reaction time, performance on activities of daily living, balance, coordination, and improvements in dual tasking, being able to carry on a conversation and walk with proper strides. So both therapy and exercise can help people with Parkinson's disease. There are many types of exercise or therapy options that have been studied and or recommended for people with Parkinson's disease. And this shows a list here. Treadmill walking has been done, dancing, doing in particular with a tango, boxing, cycling, resistance exercise, the Nordic walking, and Tai Chi. Community-based exercise for Parkinson's disease, so going to the gym, taking a Parkinson's disease specific class, does not replace therapy. And I want to emphasize this. They are complementary to what we offer in therapy. But if you're only going through the exercise and you haven't gone through therapy, I think you're missing out. And the reason is that not all types of exercise focus on this idea of amplitude. This amplitude focus is needed every single day due to the tendency for Parkinson's disease people to move slowly and with smaller movements. Again, not all exercise focuses on this sensory awareness challenges, this mismatch. Again, at LSVT BIG, we recognize that you need to feel bigger in the movement and bigger than you think you do just to move normally. And not all community-based exercise is personalized. This functional task practice in LSVT BIG is important for you to have long-term carryover, to calibrate. So my recommendation is to start with LSVT BIG therapy first and then progress to community-based exercise. LSVT BIG will help to restore and optimize your function. Again, calibrate to a new normal. Teach you what to do after treatment. Teach you how to use your bigger movements in your community-based exercise routines and the recreational activities that you do at home and in the community. And then that makes sense. So here's how to get started in LSVT BIG or LSVT Loud. You would need to ask your doctor for a referral and a prescription for a speech evaluation treatment or a physical or occupational therapy evaluation and treatment. There's a website, www.lsvtglobal.com, that has a listing of current LSVT Loud or LSVT BIG certified clinicians in your area. On the next slide, in terms of what we offer in Northwestern Medicine, McHenry County, we provide LSVT BIG and LSVT Loud services both in Crystal Lake and McHenry. So my clinic in Crystal Lake, we're at the Health Fitness Center. We do LSVT BIG, and I'm through physical therapy at the Neurological Rehabilitation Clinic, and that's just a few miles down the road from where our clinic is. They provide LSVT Loud through the speech therapist. In McHenry, they have their Route 31 clinic. They have an occupational therapist certified in LSVT BIG, and they also have at their lymphedema and speech clinic, LSVT Loud speech language pathologist. If you live in Lake County, Illinois, they have numerous PT, OT, and speech therapist, LSVT certified therapist, and there's a phone number contact if you live in Lake County. So I want to talk here just about the 4 questions to ask any LSVT Big or LSVT Loud therapist, because there are therapists that get certified, but they don't necessarily practice the standard approach that is given. So it's key to ask, do you deliver the gold standard dosage? And this means 4 days a week for 4 weeks, individualized 60-minute sessions, daily homework, and carryover assignments. There should not be, well, we do it for twice a week. We teach the principles of LSVT. You cannot call it LSVT Big or Loud unless you're doing the protocol as taught. Again, it's a good question to ask, how many LSVT Loud or Big clients have you treated? What are your typical outcomes? And then do you have a follow-up or maintenance plan for your clients? I would recommend that you visit www.lsvtglobal.com. You'll find information on webinars, patient and family section, testimonials, videos, live seminars, articles, many frequently asked questions. They provide help, support, advice, guidance, assistance, and information on all sorts of Parkinson's related topics. So in summary, LSVT Big addresses the core symptoms which all patients with Parkinson's experience: small, slower movements to sensory mismatch. The training is intense. There's an emphasis on practicing large amplitude movements, high effort. It's supported by research on motor learning, and we use all components of neuroplasticity to produce effective brain changes, basically to help you learn best. There's a standardized protocol, but we have the ability to individualize and adapt depending on the patient needs and depending on the severity of the disease. Short-term data support improvements in the Unified Parkinson's Disease Rating Scale and other measures of motor functioning. LSVT Global offers training and certification for LSVT Big and ongoing support for therapists and people with Parkinson's disease. So I would like to thank the audience for listening to my presentation. I hope there was helpful and meaningful information for those people and families dealing with and managing Parkinson's disease. I hope to one day be able to treat those clients with Parkinson's disease who live in McHenry County, so I can bring out your hidden potential and make an impact in your lives. Thank you once again. Are there any questions?
Dylan, did you see any questions?
Currently, there are no questions.
Okay. Yeah, I figured the slides kind of talk about a good structure of what it is. Like I said, if that's something you have not tried and you have Parkinson's disease, I highly recommend that you contact one of our clinics and requires a doctor's order. And again, it's different than traditional therapy in a lot of senses, and I believe it's going to be very effective in helping you calibrate.
We do have 2 questions right now. Are there LSVT clinics in Cook County?
I'm sure there are. I mean, I don't have that information right offhand, but yes, I mean, when I went onto the LSVT Global website and looked on LSVT clinicians, yeah, I saw a huge list in Chicago land area. So yeah,
there's another question for, does insurance cover LSVT?
Yes, it does. I mean, there needs to be a doctor's order. There needs to be documentation by the therapist of necessity for skilled therapy. So usually there's a functional loss, and that's done. And the part of that is there's a beginning and an end. So it's very intensive, but the goal is not to continue for months and months and months down the road, but it's to get things established, and then there may need to do a tune-up later on. But yes, insurance does cover this.
Great. So Abby is going to be introducing our next speaker shortly. Did you see any other questions, Abby, that we missed?
Nope. Thank you again, Bruce. We truly appreciate this, and it's very interesting. I deal with this on a daily basis at my facility, so.
Yeah, I can imagine. Thank you so much.
Thank you.
All right. Thanks, guys.